healthy pregnancy, call Florida's Family Health Line at 1-800-451-2229.
This is Talk 1470. WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. We're going to be talking this evening about heart and stroke, kind of take the conversation to another level. We had, if you remember, Dr. Muhammad Osman, interventional cardiologist at Florida Medical Center here on Friday, and we talked a lot about AFib and how it ties into stroke. And today, this evening, we're going to have Peta Bowen. She's an RN and a whole bunch of other credentials I'm going to ask her about in a minute on the program. So without further ado, I want to welcome Peta to the program. How are you doing this evening? Thank you.
How are you doing?
Thank you. And thank you for, I always say thank you for taking us on this adventure in health across South Florida, because we always learn so much from the great nurses and doctors on this show. So without further ado, again, the big lecture tomorrow evening at Florida Medical Center.
Yes.
The Heart and Stroke Every Second Matters lecture. It's tomorrow, Wednesday, August 29th from 6 to 7 p.m. It's in the Florida Medical Center Auditorium.
Yes.
Just 5000 West Oakland Park Boulevard in Lauderdale Lakes. So it's just the I-95 exit west off Oakland Park Boulevard, the big hospital there. And it's going to be a great interactive session. So are you going to be each presenting something? And then I really like this because people always have questions. There's going to be an interactive Q&A as well.
Absolutely. So it's going to be a panel. It's set up like a panel discussion where we'll have a brief talk about the heart and the brain and how they interact with each other. And then most of that session is going to be for the community to ask questions as well. So we'll have some standard questions that we're going to talk about, and then following that, the community will be able to ask their own questions. And if there's one thing I know for sure when I do community events, there's a lot of questions out there regarding stroke. Mm-hmm. So it's good that we're opening it up so the community takes the floor, not just, having somebody present and maybe have 5 minutes of questions. I think it'll be great.
I think that's great, that opportunity. And tell us a little bit about your role at Florida Medical Center, because like I said, you're an RN, BSN, and SCRN, but you were telling me before we went on, you're stroke coordinator.
Yeah, so I'm the stroke program coordinator. A big part of my role is looking at a very global view of strokes, the different kind of strokes, how to treat them, and how to make sure that I am facilitating the multidisciplinary team to treat strokes to the standard of care. So we're a comprehensive stroke center. And with that privilege of being comprehensive comes a lot of responsibility. So stroke patients, they require emergency treatment. They also require a lot of care when they're in the hospital, and they also require a good disposition and a good discharge plan. And so that spectrum is what I look at to make sure we're meeting government standards and Joint Commission standards for stroke care.
Yeah, because Florida Medical Center is a Joint Commission accredited hospital.
Yes, we are. We are advanced primary Joint Commission and comprehensive stroke center by the state attested.
And when you mentioned teams, so we've had a few of your doctors on this program. Yeah. I think some interventional neurologists and neurologists, and then also I guess there's stroke nurses involved in the whole process as well.
Yeah, so in my particular case, and you're talking about my credentials, so I'm a stroke certified registered nurse. It's a board certification by the the Neuroscience Nurses Association, so the ANN. It basically, they give you extra training. You have to sit a board exam and pass it and get a certificate stating that you have advanced knowledge in stroke systems and stroke care. In terms of the expertise that's needed, stroke is very particular. We're making a lot of advancements in stroke, and so you do need that specialized care when you come into the hospital. So multidisciplinary teams means everyone from the ER, radiology, radiologist, neurointerventionalist, neurologist, intensivist, in rehab, speech, occupational therapy, dietary, case management, social work. So it's an entire program that just focuses on delivering the standard of care every time for every stroke patient that comes in.
Wow, that's great. Thanks for clarifying that, because I kind of pigeonholed that. It's a much bigger team, and that's great. I love the team-centered approach. We have doctors on here all the time, and they really, kind of strive with that in a way. They kind of, the word I'm looking for is focus on that.
Yes.
I think that's changed in healthcare in the last, as long as I've been in healthcare, which is only 6 years, which it's like a minuscule amount of time.
We've made a lot of advancements in treatment of strokes in the last 2 decades. I mean, things are going at rapid speed these days. So just to clarify, so strokes are genuine. Yeah. So can you hear me? Okay. So strokes are typically classified as ischemic strokes, which is where a blood vessel is being blocked off by a clot, or it could be a hemorrhagic stroke, which is a fancy way of saying the opposite, so a blood vessel bursts instead of being blocked off. So you can have two. The most common kind, and 85% of strokes, are due to ischemic strokes. In terms of ischemic strokes, there was decades ago where you would come in with a stroke and all we could give you was an aspirin and give you some therapy. So today's day, we have 2 different type of treatment modalities for stroke. So we can give TPA. So the fancy word for TPA is tissue plasminogen activator. It basically activates a protein in your body to increase this substance that can eat clots and break up clots, okay? There is a risk that comes with that medication, which is bleeding. And because of that, we have a time window to give that medication. And that time window is 3 to 4.5 hours. So that is why when we talk about strokes, we encourage the community to always call 911, because number one, 911 takes you to where they know you should be, okay? Because if I live on commercial and 441 and I'm having a stroke and I drive, I'm going to drive to the closest hospital, but they may not be a comprehensive center. Okay, so you may not get the same kind of urgency and type of care that you
want the experts to take you, exactly.
Right.
Yeah.
So you let EMS make that decision for you, especially in an emergency like a stroke. So we have a 3 to 4.5 hour time window to give TPA. If you fall out of that time window, we can't give it to you as far as when your stroke symptoms started. So if you're outside of 4.5 windows for your stroke symptoms, maybe you went to sleep, woke up, and now it's 8 hours gone, we can't give you the medication. But we do offer a different kind of therapy as well, and they're not exclusive of each other. We can give you the medication if you're within the time window, and we can actually go in through your groin. If it's a big enough clot, go in and fish out the clot. And so that is what our neurointerventionalists do. But strokes can happen anytime, right?
Yeah, anytime.
Anytime in the morning.
Almost any age in a way, because we've seen stroke. I mean, I've covered a testimonial before of a 12-year-old boy all the way up to, mid-90s, 100 years old.
Yeah. It can happen anytime to anyone. So the idea behind being a comprehensive is that you have the expertise 24/7. And that's every kind, the neurologist and the neurointerventionalist, because you never know when these things can happen. So that's kind of what sets us aside from other hospitals in Broward County in terms of being comprehensive.
This is great information. It's Peta Bowen, RN, stroke coordinator at Florida Medical Center. So that's floridamedcenter.com. You can check them out. So floridamedctr.com. Like I said, 5000 West Oakland Park Boulevard, Lauderdale Lakes. Their number is 954-735-6000. And tomorrow evening, Wednesday, August 29th, from 6 to 7 p.m., once again in the Florida Medical Center auditorium, there's a lecture, Every Second Matters, and we're going to talk a little bit about the timeliness and that quote right there. That is so important. Yeah. We're going to be talking about heart and stroke. It's Dr. Muhammad Osman, interventional cardiologist, who we're lucky to have on this program this past Friday. It's Peta Bowen, RN, stroke coordinator as well, is going to be there. And there's two other panelists, which I'm going to list right now. Arlene Barrett, MSN, and Alana Brown, MSN as well.
Those are both the nurse practitioners for our cardiac program and our neuroscience program.
Wow, and this is a free event.
Yeah, it's free. It's open to the public, all ages.
Great for caregivers, great for family.
Absolutely.
Because unfortunately, I mean, friends and family, there's probably going to be a time in your life you're going to know someone affected by stroke.
Absolutely.
I'm going to tell you that, because luckily we have practitioners or nurses like you and great doctors to help out with the care and always taking it to a whole different level here. But the education, the public education, is very important. Call the EMS, call 911. They're going to know where to take you and what kind of, whatever shape that they assess you in. Know where comprehensive stroke centers are, primary stroke centers, etc. Know the difference. Learn information about heart and stroke, because we've learned a lot in the past few years. Atrial fibrillation with the heart has a lot to do with stroke.
Absolutely.
Ties together.
Yes, it's called sometimes the heart tricks the brain.
Wow. Unbelievable.
So you could have that underlying cause. Strokes, the ischemic strokes can be due to, something coming from the heart or something in the vessels that's built up and has caused some tightness in that vessel, and you build a clot in that vessel. So that's high cholesterol, and we can talk about risk factors that are modifiable and non-modifiable. We'll definitely get into that at our lecture, our panel, open panel tomorrow.
And you can reserve a seat just by calling 844-502-7051 or call Florida Medical Center. I'm sure they can get you that number again, 844-502-7051. And it's a free panel, 6 to 7 p.m. tomorrow evening. Peta, hold that thought. We're going to take a quick commercial break, and on the other side, talk a little bit more about the heart and stroke on the Living a Longer and Healthier Life show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and welcome back and beyond, because we're on Facebook.com and iHeartRadio, everywhere. Again, Peta Bowen's on the program, RN, stroke coordinator at Florida Medical Center. We were just talking before the break about Comprehensive Stroke Center. Florida Medical Center is a Comprehensive Stroke Center, and that's very important. Can you explain some of the standards associated with that designation?
Oh, sure. So a big focus of our quality metrics is door to needle and door to groin. So that basically tells us, so door to needle is when you're a TPA candidate that we talked about before. So you're within that window, 4.5 hour window. How quickly from you arriving to our doors can we give you that first bolus of that medication? Now, when you come in with a stroke, we don't know what kind of stroke you're having, right? As we discussed before, 85% of strokes are ischemic and 15 are hemorrhagic. The thing is, we can't give a clot buster to a stroke that's hemorrhagic because we would harm the patient, okay? So first, we have to figure out what kind of stroke you're having. The only thing that can tell us that is a CAT scan. So we have to move at lightning speed once you get to that door to get you to CAT scan to determine what our clinical management is going to be. From there, we give the TPA bolus. So according to standards, Joint Commission standards, patients do best if you are able to give that medication within 60 minutes from door to bolus of the medication. So that means you have to get them the CAT scan, get IVs, do an NIH.
There's a lot going on.
It's an entire team. Okay. And of course, the help we get is when rescues calls us from the field and says, hey, we have this stroke case and this is the score, and we're now waiting for that patient when they come to the door. And that's generally how we work. So they don't go to a room, they get assessed by a physician immediately and go to CAT scan. So currently our average door to groin is very well. We do very well. It's currently about 30 minutes. So we're working half quicker and getting, so that's part of our quality improvement, right? So if we can do it in 30 minutes, let's do it. If we can do it in 25, let's do it in 20, because we're saving brain tissue. So when you have an ischemic stroke, 1.9 million neurons die per minute. So, and you can't get it back. Once brain tissue dies, you can't get it back. Cardiac tissue, a little different, but brain tissue, can't get it back. You lose the function. And then you have another measure that we need to meet as well. So sometimes when you have a very big occlusion, we do the CAT scan, we do all of that, you're not bleeding, and you have a very big occlusion, meaning a main vessel, right? That TPA that we give you that activates your body to eat that clot, sometimes it's not enough for such a big clot. Okay. And so from there, we say, okay, well, are you a candidate for this procedure where we go up into your head? The good thing is, recent studies just came out, our new treating ischemic stroke, our guidelines came out, and they said even if these patients don't qualify for TPA because they waited too long, to do a thrombectomy, which is what they call it, where they go up and pull out the clot, they've extended the window from 6 to 24 hours from last time seen normal. So even if you woke up and came to the hospital and you're having a big enough stroke that has a clot that we can retrieve, we can take you. So we don't have to give TPA. We can just go in there and take out the clot. With that particular measure, The standards say if you are able to take that clot out within 90 minutes of that patient coming in to the door, from coming into the door to the time groin puncture, that's why they call it door to groin. So that's the time you can get access to get into the brain to actually see a clot to pull out. It should be 90 minutes. Okay, so we strive at FMC on every case to be less than 45 minutes. There's been times where we've gotten to clots at 30 minutes. Okay.
Whoa, that's fast.
Yeah. And so that just, it all has to do with communication. EMS communicates with us. There's a level of urgency. We have an entire electronic communication system where everyone knows there's a stroke coming in. And it's a very organized system. And one stroke patient they will at least pass through the hands of at least 25 to 28 healthcare providers.
That
so
is great.
Between EMS and ER and the cath lab, one of those cases. So it's that whole team effort. Everyone has to be in sync with each other.
That is great. Thanks for explaining that. And
Yeah.
the experts, Florida Medical Center, it's floridamedctr.com. You can find out a whole bunch of information about the hospital there. And then, like we said, tomorrow evening, there's Peta was talking a lot about time there, and the talk tomorrow is Every Second Matters. Yeah. We know we've heard on this program, and great medical professionals like you tell us time is brain. You just told us why. 1.9 million brain neurons
per minute
can die during a stroke. That is a lot.
So
and you don't get those back.
No.
Big deal. So tomorrow evening, 6 to 7 p.m., there's a Q&A panel discussion. We have a doctor there. Peta's going to be there. She's a stroke coordinator. The doctor's an interventional cardiologist. There's two other medical professionals or nurse practitioners. You said that. See, I'm learning here. I'm going to attend tomorrow night, 6 to 7 p.m. It's free. There's a Q&A as well. So it's definitely a great opportunity to learn more about the heart and stroke from the great medical professionals of Florida Medical Center as well. Tell us a little bit about the signs and symptoms of a stroke. I mean, what can family members, friends be looking out for their loved ones?
Sure. Okay, so the word stroke comes from strike. Okay, so stroke symptoms strike you, and so they come out of nowhere. So most profound symptoms you'll see is a drooping of the face. So everything is going to be on either the left side of the body or on the right side of the body. Okay, because that's how the brain is worked. Right side of the brain controls the left side of the body. Left side of the brain controls the right. So you could see with patients with stroke, they're going to have weakness. They're going to have trouble speaking. They may look a little dazed. They may walk funny, but definitely a facial droop, any kind of weakness, not answering questions, not really following commands, and of course, just any problems with the eyes if they're gazing one way, gazing the other way. Those are usually telltale signs of a stroke.
Just something out of the ordinary. It's time to call,
And it strikes all of a sudden.
Yeah, all of a sudden. Yeah. I once met someone during a testimonial as well. A lot of people know I do PR. But long story short, they saw that their mother was reading a pizza box upside down. And they were, hey, Mom, what's going on? And, oh, I'm just going to put it in the microwave. But you're reading it upside down. And then he looked at her face, and it started drooping. And I think maybe like drooling or when she took a drink. And he called 911 quick. And great professionals like yourself were able to get her in and out of the hospital and save her life and save brain cells. Because a lot of that time is the quicker you're treated, the better outcome, right?
Better outcome. And that's our goal, right? There's lots of risk factors for strokes, lots of reasons that cause strokes, and we're going to talk about that. So tomorrow we'll talk about, so we divide it into modifiable risk factors and non-modifiable. So you can't help, how old you are.
Like diet would be modifiable.
Well, diet is modifiable. You can't help how old you are. You can't help what ethnicity you are. You can't help if you have an underlying condition that puts you at risk for a stroke that you were born with. So those are non-modifiable, and you can't help, of course, what gender you are. So, but with modifiable, you can definitely help, because remember now, a stroke is a vascular disease, and it's usually a result of. It's not a primary disease in itself. So if you're having a stroke, it's because something has been breaking down, or there's been some poor habits along life, and now the body is forming these clots, or you're getting a bleed, or, you know, whatever the case is. So there are risk factors. Some people have higher risk factors than others. But again, time, I cannot stress how much time is of essence, calling 911. And of course, if you do have a stroke and we treat you, maintaining your health, because once you have one stroke or even a TIA, you're at risk for having another stroke increases tremendously.
Let me see if I can guess. Is that transient ischemic
attack?
Almost. Thank you.
Yeah.
For explaining that. And I will say, I've been at a lot of hospitals in the area, and EMS do work together with you. There's even meetings that go on when the EMS crew is not out on their in the ambulances and fire trucks, that they meet with different hospitals. This goes on across South Florida. You know these people by name. You share
Absolutely.
The best.
Yeah. So anytime we have a really good case, so the biggest thing about EMS is feedback. They want to know how their patients did.
Because they don't know. They leave.
Don't know. They never see. They come, drop them off. They got to do another run.
One true thing about that show, 911, right there.
They never know. So when we have events, so we have our call of the quarter. And so we get the patient back and get them to meet their crew and get them to meet their physician, because everything is so, they never see that end of it. So anytime we have a good case, we usually send them immediate feedback like, hey, great job, guys. But for the most part, the Broward County EMS team, they're very engaged, and they're a big partner in helping us reduce disabilities with stroke.
That's great. Peta, I can't thank you enough for bringing so much great info to the program. I really appreciate it. You're always welcome on here, Tuesday or Fridays, anytime you want to get the word out on anything. Again, check Peta out tomorrow. There's a heart and stroke Q&A panel discussion at Florida Medical Center, 5000 West Oakland Park Boulevard, 6 to 7 p.m. tomorrow evening. Go there and learn a little bit more why every second matters. Thanks for listening.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and